Thank you, and thank you for the organizers, because we think that there's a role for regions to play in the development and implementation of personalized medicine, and especially through the actions of the Vanguard Initiative, which is based on the concept of smart specialization. And I would like to explain a little bit more what this concept is, and because it takes a while before you get into the understanding of what is behind. So smart specialization is building on the regional assets and resources that are around. So you have to identify those opportunities that are there to build on for further development and growth. So it means that you don't have to do or try to do everything, but you have to make choices where you put your investment in. And that has to be relying on your strength, but also on the real capacity, on the background, what is there, the critical mass, and the entrepreneurial resources behind it. So the entrepreneurial discovery and the inclusiveness of the maximum of stakeholders is one of the very important aspects here. So you need to develop this broad view of innovation, which is at the technological level, practice-based, and also to include social innovation. And all this is to be backed with a sound monitoring and innovation evaluation system, because it's important to realize impact. So this, in regions, they are encouraged to put this down in the regional innovation strategies, the regional research and innovation strategies for smart specialization. So that was already in the previous multi-annual framework. Most regions had such a strategy, the RIS3 strategies. And when we analyzed this under Sapphire, among others, we saw that most regions have included health. Some specify with personalized medicine or precision medicine. And in the regions that responded to the survey we did in Sapphire, there were 10 regions who really had a specific personalized medicine policy included in their strategies. Some of the regions indicated here in red reported no priorities with health or personalized medicine. So what is the Vanguard Initiative? This is actually a network of 39 regions that are the most advanced in industrial level. So they have put down in their research strategies that they want to build, that they want to advance here further, building in this concept and create European value chains. And they want to connect this with the other by interregional collaboration to try and take things further. So in this way, they want to increase the interregional collaboration, ensure that there's interregional investments, and in this way strengthen the open innovation and take things further in their process of development. This needs a political commitment, so it's not only important to bring people together, it really needs the political commitment of the regions, it needs the entrepreneurial commitment, and so all the ideas to have this industrial innovation going in also with an international focus. So you see here in colored in yellow the regions that are part of this network. And the concept is also in this quadruple helix where you bring business together with academia, the policy level, but also the broad society, the citizens themselves. The Vanguard Initiative then developed pilots according to dedicated thematic areas. And the idea is to accelerate the market uptake and innovations in those thematic areas. This is also with the idea to support internationalization and competitiveness. And so it's a gathering of industry clusters, science parks, research institutions, and universities. So, and that brings an ecosystem where you can discuss common objectives and complementarities. You'll be able to map what the strengths are in the region and to understand the industrial competences and capabilities in the regions. Based on that, you can develop an action plan with a critical mass and find alignments with other regions where you have the complementary strength, and in this way combine the efforts and attract strategic investments. So in this way, with the matchmaking, the idea is to support the local industry and take things a step further. This is too small to read. The pilots, the Vanguard Initiative pilots, so they are all about developing projects. They are called the demonstration projects, where you increase your, so those projects are at a higher technology readiness level. So that means post prototyping. And you have to ensure this this industrial commitment. In this way, the idea is to create a network of demonstration projects around Europe, and so all with the idea to accelerate the market development and increase the global competitiveness. So these demo cases, they share common objectives to share access to facilities, to infrastructures, to share access to technologies or develop new technologies. So each of those demo cases, they are built in a combination of complementary demonstration facilities. So by grouping those, you can increase to even higher technology readiness levels, and also to go to industrial replication and upscaling. So you can envision then 3 types of demo cases, and that is creating access to existing infrastructures, building new infrastructures, or creating challenge and technology-driven new initiatives, or a combination of those types of demo cases. So the idea here is then, so to summarize here, so first you have the learning phase where you do the mapping across the region to identify the strength in the region, and in other regions to find those complementary actions. You bring this together by connecting the regions or the stakeholders that are relevant here, and in this way you can build those demonstration cases. So you go in the higher tier technology readiness level, and the final step is then to go to real commercialization, where you have the upscaling and bringing new value chains to the market. So the idea is you start from industry-inspired to industry-driven aspects to industry-owned initiatives. So this is the conceptual approach. Now, under the Vanguard Initiative pilots, there are, in the meantime, 8 pilots. One is not there because it's the latest one is on hydrogen, but one relevant here is on smart health. And so what we did, like the process said, we did a mapping and scoping, and then we identified that we wanted to work on smart health, identified as building on 4 pillars. So on data, the convergence of technologies, what we call P4 medicine, and on skills of the future. Now, what we understand under these pillars is, for instance, data, you have to consider the different types of data, real-world data, or data buried in the electronic health records, but you have all different types of issues related to those data, issues connected to ensuring privacy, security, access, storage, computing. And so you can envision that there are multiple value chains can be built here in service provision and so on. So what we want to make sure is that we allow those projects to be developed under such under this concept. With convergence of technologies, we refer to bringing together biotechnologies, nanotechnology, engineering, miniaturization, to develop those new novel technologies that based on omics, microfluidics. We heard about single-cell technologies. And also here you can envision multiple new value chains to be developed in this complementary way across interregional collaborations. With P4 medicine, so referring to preventive, participatory, precision, and personalized, or healthcare of the 21st century, if you like. Also here, you can have multiple new developments being developed and brought to market and the society at large. And the fourth pillar, I think, is not the least, because you need a workforce that is skilled to be able to deal with those highly technology, novel developments, highly data-driven as well. So we have to ensure that there's a skilled workforce ready to bring everything to society as well and support it. So that the Vanguard Initiative is actually working is also illustrated here with a new multi-annual financial framework that is running to 2027. There was a new investment initiative instrument being developed, and this is the I3 investment, which stands for Interregional Innovation Investments. So this is covering a budget of 570 million euro over those 7 years. And this is meant to finance this type of Vanguard Initiative projects. So we think that this will be an important leverage factor for the future developments. The Vanguard Initiative is also present in the Industrial Forum and is advising the European Commission in the implementation of the industrial strategy. The Vanguard Initiative is also present in many different meetings and gives presentations to present this concept of smart specialization, and actually also discovered more recently in this current framework the new fields of work, such as related to the European Digital Innovation Hubs, but also linked to the European partnerships. And here I would like to focus on that there is already a precedent with an agreement of the Vanguard Initiative with the EFRA. It's European Factories of the Future Research Association, which signed an agreement for collaboration in the partnership on Made in Europe. And I think this is a model which may also serve in the development of personalized medicine, as we are in the preparation for partnership on personalized medicine as well. So I think what we've seen here, the example of Israel with the global aspect, the national aspect, but also the regional, interregional collaboration. I think it's all about collaboration, in fact, and we all defend, I think, the same agendas if you come to the decision. So it's joining forces in this quadruple helix aspect. If we do it with the regional aspect, we can also include the regional funds that are available and ensure that we, in this way, bring the personalized medicine to everyone. So I would like to end here and take questions if you have one.
Thank you very much. Let's give him a big hand. Oh yes, that was really interesting. You said in the end that Europe is also about regions. It's not only about capitals. Yeah, that's the beauty of this initiative, I think, and it's also politically very wise that we try to include all the capacity and knowledge and facilities that we have, also outside the capital regions. Yeah. So, any immediate questions to you? I have one again, because I think that this is a beautiful example and actually comes from a ministry that is not specifically a health ministry. That also medical innovation, medical research, health systems can benefit from infrastructures that were originally put together for a general purpose or maybe for an entirely different purpose. So what I said in the beginning is that we should start thinking out of the box, that we are not alone in society, that we can give, but we can also get a lot from collaboration with other paradigms, with other fields of science, other fields of governance and so on. So I think that that's a very interesting initiative, and I personally will keep an eye on you in the future. Okay, please take your seat. We have another 10-15 minutes to go for general discussion, and we decided to invite Markus Kalliola from Helsinki, Finland, who just arrived today, to be a panelist here because you gave your presentation yesterday over the web, but people might not have had the chance to ask questions about your expert field, which is health governance and utilization of data, both primary but particularly for secondary purposes. And you work in the TEHDAS joint action that works towards the implementation of the forthcoming European health data space. So Markus, please take my seat and I'll move over to the podium. You might just say a couple of sentences of your expertise to introduce you to the audience again, please.
All right. Well, you heard me yesterday. So my name is Markus Kalliola. I work for the Finnish Innovation Fund, which is an organization under the Parliament of Finland. And my activities at the moment mainly linked to the secondary use of health data within the European health data space scope, and then also making the health data use more efficiently in Finland nationally. So as an innovation fund, we fund also innovations in Finland. So I have two hats, so to say. But I was thrown cold water here coming to this panel because I thought that I would be tourist today and just enjoy the show. But no, Liisa-Maria drew me in, so here I am.
Yes, we happen to know each other, as you might have recognized. Okay, so I've prepared a couple of questions to our panelists, and I will put together the first two of those and ask everybody of you to answer the questions, which go like this. Who are your three most important customers or stakeholders? And how do you communicate with them? You have actually told us about the communication, but it's always difficult to rank because everybody is important. But at the end of the day, to whom is your organization accountable? Just name a few. I'll give you a few degrees of freedom when you address this question. And if we start, okay, please.
So yes, I mean, we've built the innovation strategy to include all the stakeholders that are responsible for innovation, whether it's our own researchers in an academic environment, to the startup companies that are eager to change the world, to the industry, and of course looking at academia. So they are the bringers of change, but we're all doing this for the most important stakeholder, which are the patients. And this is very, very important to remember that. That is why, ARC was built starting from a hospital. Used to treating patients, being able to understand and look at patients and see that this is where we have to focus. The examples I provided are very patient centered in that regard, being able to predict deterioration in disease and respond in time to prevent it. We all have to remember that we have to focus on patients. And I think working in a collaborative such as this, and we heard about other private-public collaborations here in the other talks, I think it is very critical that we have the patients utmost in mind when we bring this to happen. So I would say they are the most important stakeholders.
Thank you very much. And over to Jutta.
Yes, so I mean, we already have a group of stakeholders within the consortium, and I think they are all equally important. We need the hospitals, we need the industry, and we also need the health authorities. And within the consortium, I think everyone is accountable also to make an effort to contribute to the common goals. And I think people really try to do that. But then the other stakeholders we are working for or we need an interface with is, of course, the patients. I mean, as you said, that's the ultimate goal, to improve the patient care and to bring precision treatment to patients that are in need for that. But then it's also the decision makers in the healthcare system. And I mean, we don't have any official mandate in Connect, but the initiative is applauded by the decision makers. So then for us, it's important to really have, and that's the goal also for the next phase, a defined and more regular interaction and interface to really ensure we will have an impact.
Thank you, Jutta. Then over to Kathleen.
Yeah, I think I already answered the question. So it's a quadruple helix that is important in the development of this Vanguard Initiative. Now, at my work for the ministry, we have a mirror group with the regional stakeholders, let's say. But the focus here is, my department is on research policy and innovation. There are no patients involved because I'm not allowed to do that. But of course, we know that the main outcome, we hope, is for the benefit of society. Mm-hmm. And we do have an interregional initiative, which is covering science and innovation policy and the healthcare department. And we try to use this interaction to bring innovations to where they are needed, to the healthcare sector, but also to understand what the healthcare sector needs. Because if you have a development and a nice innovation, and people ask, what will I do with this? It's not working. So we need to understand the needs also, and I think this is sometimes forgotten, but it's difficult very often to bring innovations to where it's to the professional side or to patients and society. That is a really big step sometimes to make.
Thank you so much. And Markus, do you want to comment on this question?
Yes, sure. Well, if you think about the European Health Data Space, it of course supports both the patients and the healthcare professionals in the primary side, and then on the secondary side, it's the whole research community and decision makers. If I think the Finnish Innovation Fund, where I work, we of course support the whole society.
Thank you so much. I had a couple of other questions, and I tried to put them together too. One of them is that, we work within certain frameworks, and we all have also limits. In your activities, have you recognized red lines which you cannot cross? And why are they there? Are they put on you, or forced on you, or did you choose them yourself? And finally, what do you define and how do you measure success? Over to Eyal.
So in terms of red lines, I briefly mentioned that before. We all talk about data, and obviously there are many red lines in data, especially if we have the patients in mind. How do you find the right way to actually provide the value or benefit the value we can have from data, but without jeopardizing patient confidentiality? This is a major issue in Europe. Not so much in the US, less than in Europe, I would say. And Israel is somewhere in between. in that regard, but this is something for our perspective that has been central. As I've mentioned before, we are not in the business of selling data to companies, for example. We are approached a lot because of the amounts of data that we have. And typically the conversation goes something like this, you know, they offer us money for the data, and we say we're not in the business of selling data, and they say, well, we're going to pay you a lot of money, and we say, sorry, we're not in that business, and you know, finally they get to they understand the answer. So there's a definite red line in that regard, but I think we cannot just stay idle. We have to always look for the right approach. There are many solutions to that, whether it's federated learning or whether it's synthetic data or other ways to work with data, and I think we have to explore that. We have built our data infrastructure in that regard to allow us to use data in a very safe manner, and I think this is something that's on all of our tables. I will say one thing on the outcomes, which is critical, because we many times measure the outcomes that are easier to measure. We all know this from our day-to-day. We call it, you know, what's under the lamppost. We measure what's easy to measure, but not what's important to measure. It's critical, of course, if you have the patients in mind and they're at the center of what you're doing, to measure outcomes that matter to the patients, and many times they're not easy to capture. I mentioned patient-reported outcomes before, and when we talk about value-based healthcare, you know, they are critical to measure, and we're still working by asking them questions on an app, which I think 50 years from now would look like very, you know, prehistoric. Why would we ask questionnaires of our patients? But that's the best way we can do it today. In the future, we'll have better ways to collect data from patients and understand whether the treatment was effective in the fashion that we would like that to happen. So definitely this needs to be our main goal. We're focusing on that many times, and some of the examples I provided are along the same lines.
Yes. Thank you very much. And over to Jutta.
Yeah, I think within the consortium, the red lines would be really a fair and open and trustworthy behavior among consortium participants, so that no one abuses any role that she has in the consortium to put forward like an own agenda. And I think this is very important, and sometimes maybe results in, for the time being, a quite careful behavior. So everyone has a strong focus on trust and partnership and quality, which is super important. And then it's how, you know, to cross not a red line, but to cross the line towards really having an impact and dare to exploit novel things and pilot, and maybe sometimes also be a bit provocative to change things. And I think sometimes what I sense is a bit of a red line. We don't have an official mandate. We are also, to a certain extent, a bottom-up initiative. And then it's very important how we then approach and deal with the decision makers. And sometimes here I also feel we have to define good formats, and when we invite them for like meetings that we call idea exchange meetings, that is still like a process where we have to develop a lot of consensus within the consortium about the wording. And yeah, so maybe these are some red lines in terms of we have to respect these, of course, and we have to, but there are also things that we have to overcome to allow really to become innovative. Yeah.
Please, Kathleen.
I see, from my perspective, two limitations. One is obvious, it's budget. So we have a lot of people knocking at the door of the ministry, asking for support for new wonderful projects. But unfortunately, there are limits to the budget. And very often this is unfortunate. Another limitation is also this need, what we just discussed also, to bring innovations from science perspective towards the healthcare sector, because I'm not allowed to interfere there, and vice versa. But we need to overcome those silos as well. And this is not always obvious. Also, the sharing of data, when it's health data, it's sensitive, it's protected. The demand to have access for the secondary use of data is very high, but it's not always so easy to convince the healthcare sector to share the data for basic research, for research in the industry, because access for the industry to healthcare patient data is even more sensitive. So there are a number of aspects that need to be overcome still.
Well, that was a good introductory point to Markus Kalliola, who in his daily work addresses this issue. Markus.
I think when we are talking about the red lines, I think this is one of my favorite topics that we could talk for hours regarding the European Union and health policies and where are the red lines, because the health in health systems are in the competency of the member states and not in the EU. So what can you really regulate in the European health data space? And that's why the Commission founded it in an article of the Treaty of the Function of the EU 16 and 114. So 16 is the personal data topics and 114 is the internal markets. And not on the 168, which is the health clause, health article. So I think this is the sort of big debate in the EU. Where do we want to go as a union? How much health union we want to build and how much we can build without opening the treaty. I quite like the European health data space as has been argued now, or argued, and that we can really share data. We can do this as a single market basis. But at some point of time, we need to also to touch the red line that we need to also have common ways of perhaps running healthcare in EU in more common manner. Maybe it's not today, but in a few years to come.
Thank you, Markus, for your personal point of view. We have heard really fascinating and a little bit provocative ideas from the panelists. And now I see a question, at least one from the audience. The lady over there, please. Can we have the mic?
Yes. Hello, I'm Rizwana Mia from the South African Medical Research Council, and we've just joined the IC permit, and listening to the level of collaboration that you have showcased here today, and the experience you've had, especially with regulating data and sharing with industry and industry partners. I mean, what would your advice be for a country like ours that's just starting up in the precision medicine space, trying very hard to wrap our minds around the data regulation, and especially in the face of new policy, because we have a policy that we feel might, I think it's the same policy you face anyway in the EU. You have very strict personal protection policies, and we are very similar. So we're trying to, at government level, implement something, but where would you say we should start? How do you, and especially the panelists from Israel that has a very strong industry partnership, how do you manage it, and what is the incentive with industry? Because we find industry is always incentivized by data sharing. Thank you.
Can we have an answer from you? Yeah.
So it's a great question. I think if you're going on this path of setting up regulations and policy, you definitely have a position to learn from some countries that have been a little bit more advanced in terms of promoting this over the last couple of years. And there are good models to learn from and to implement. Building, and we saw it here on this panel as well. I mean, looking at public-private collaborations, this is something that can work. It needs to work. We're challenged with funding. The industry has more money than the governments have, and they have a clear incentive to develop. I think we need to find the right incentives to all come around so that we each see the benefit for ourselves, but it can work. There are many models that this has happened. Data sharing is critical, And I know in South Africa, we also have some partners in South Africa. So we've seen some of the challenges with data there, but I've seen already, for example, some of their insurance companies like Discovery and others that we work with that already have concrete amount of data that can serve already for precision medicine purposes. Also, I would say, if you're starting on this journey, think about where there isn't too much data. For example, collecting data from wearable devices like smartwatches is something that very little are doing around the world, and can have a lot of impact. So starting not from the basics, but already looking to see where we're going in that direction. Collecting data like patient-reported outcomes. Actually, I've just heard of a wonderful patient-reported outcome program coming out of South Africa a few days ago. So this is something that I know is happening. So, it's really looking at all the resources that you have nationally and then coming up with the right approach, which again exists in other countries. So it's much about learning, much like is being done here in this conference.
Thank you so much. I think that we have now come to the end of our session. We need to have some time for the coffee break. Thank you so much for taking this topic to the agenda of this meeting, because, as I said in the beginning, not even personalized medicine lives in isolation, but it's part of society and needs the stakeholders also from the public sector and from the governance and governments. Thank you so much.